This discussion is about the systematic search. And the systematic search falls under the second stage of evidence-based practice. And if you may remember, during the first discussion, the first test of evidence-based practice, we used to ask a clinical question. And a clinical question was derived from a clinical issue. And if you may remember, the PICOT format is what we used to analyze during the first step of evidence-based practice. And systematic search is intended in order to find a relevant evidence in order to answer a clinical question. For an EBP practitioner, this is not an easy task. Systematic search entails practice. That's why you have to master this. This systematic search seems to be a clinical skill for EBP practitioner. And when we want to master something, we keep on practicing. And one thing more is that systematic search will require that in order for us to learn this, the best way to learn this would be to actually do it and not just but to talk about it. The following are the strategies for systematic search. Now, in order for us to come up with a good result or the best evidence that we want to get, we have to strategize. We have to make our search systematic with the use of strategy. And these are the following. Number one, we have to determine the search terms. And as you may remember, this is being done by analyzing the clinical issue, making a clinical question in a PICOT format. We have done this. Second would be the determination of the databases. Now, determination of the databases is something that we are about to discuss in the coming slides. That means what will be the search engine that you will use when you determine the databases. Then you will construct a search strategy. This is a procedure on how you will write a word or a group of words into the search box of the database. It will be followed by selecting the evidence to read. And when we select the evidence to read, we classify them according to the type of question, and each type of question has a corresponding hierarchy or level of evidence that we will follow. And then we will organize a citation and search strategy. That means we will find the order, we will try to save, we will try to print, and then finally we have to obtain the literature, and that is by printing, by saving, and also included in the last two steps would be on how to retrieve, okay, the search history when we want to go back or when we stop working and we happen to find time again, then that's the time we have to do the procedures number 5 and number 6. And finally, obtaining the literature will be the end product of that. And it will lead us to the third step of evidence-based practice. This is determining the search term now. Let's talk about determining the search term. And in order to do that, we will be having steps. And the following are the steps that we will follow in order for us to determine the search terms. In determining the search terms, we want to know what exactly are the words or the group of words that we are going to input inside the search box. So in dealing with that, first, we will have to choose a topic, or this is what we call the clinical issue. And then after that, we will develop a PICOT question, or what we call the clinical question, the searchable and answerable question. And then we will identify the keywords or the key concept that we have to type inside the search box. Now, to understand this fully, let's take a look and listen as to how it is being done.
Literature search. Let's try one for practice. Consider the following scenario. A 45-year-old woman with clinical depression reads in Redbook that St. John's wort can be taken for depression. As her physician, what research can you find on the effectiveness of St. John's wort in treating depression in adults?
Now, take a look at this. This is our scenario, or this is what we call the clinical issue. A scenario says there is a 45-year-old woman with clinical depression, and that there is a need to treat that depression, and St. John's wort is the intervention that is being proposed here. And this is how we deal with clinical issue. Let's see what follows next.
Using PICO, let's identify the important concepts. First, who is the patient? The patient is a 45-year-old woman with clinical depression. Now, what intervention are you considering to treat her? St. John's wort. What is the comparison treatment? It is a placebo. What is the desired outcome? It is the efficacy in treatment of depression. Finally, what kind of clinical question is this? It is a therapy question.
Okay. From the scenario, it is so clear that they have derived all the necessary information in scientific format, which is the PICO format. We have the letter P, the I, the C, and the O, and finally the letter T. So here, the problem is that there is a clinical depression with 45-year-old woman, and then St. John's wort is the intervention that they are thinking of, and they will compare this St. John's wort with placebo. And then they will look after the output, which is what will happen, how will it treat the depression. And in order for us to finally think of what type of evidence are we going to look for, we have to know what kind of a question is this, and that it is being identified as a therapy. What will be then the purpose of identifying the type of question that a scenario may lead to? This is necessary in order for us to identify what kind of evidence we are looking for, and that is what's we're going to be looking for in the coming discussion.
Thus, our clinical question could be stated as follows. Is St. John's wort more effective than placebo in the treatment of clinical depression in adult women?
Okay, so it's loud and clear. Now we know that from the clinical issue, we will create an answerable and searchable question, and that's what we call the clinical question or the PICO format of question. And after having all of that PICO format of question, then what would be the next thing to do? Now that you have the PICO, and so what? If you have the PICO now, the next thing to do is identify your keywords or your key concept. Let's take a look and listen on how it is going to be done.
Start with the essentials and add more as needed. When it comes to search terms to pick, the intervention is usually the most helpful, followed by the comparison and the patient. The outcome is usually least helpful when choosing search terms. Therefore, the concepts that we will use for our literature search are St. John's wort and clinical depression.
Okay, you have to take note that it has been described that in order for you to rule out what keywords are you going to use, the rule says first you have to look for the intervention. The intervention would be the very first to consider, okay? And this will be followed by either the comparison or the problem. Okay, so in the clinical scenario that has been derived earlier, there are two keywords that has been generated, and the keywords or the key concept. When I say key concept or keywords, these are the most important words that we have derived or extracted from the clinical issue. And here we have it: St. John's wort and the clinical depression. Makes sense, right? Because this seems to be the problem, and this seems to be the intervention. Okay, let's continue. So this is the determination of search terms. Again, if we want to determine the search terms, we read the clinical issue, we analyze the clinical issue, and then we will create a clinical question from the issue, which is in a PICOT format. And then what will we do next? Then we will identify the keywords or the key concept. And then what's next? And that's what we're going to talk for the next slide. We are now with the second step of our systematic search, which is determining the databases. Now, from the word itself, what exactly is this databases and what it is for? Now, let's take a look at this. Databases are organized collection of index, scholarly academic information. And this can be accessed, this can be managed, this can be updated, this can be saved, this can be retrieved. And this is synonymous with the search engine. So that's exactly what a database is. Now, there are things for us to know before we go on with the search of a database. First thing first, before we access the database, we have to be familiar with the database. Now, when I say familiar with the database, you should know at least the features of that databases. What does it offer? What exactly is this all about? We have to know the details of that database. And that is, we are trying to be familiar with the database that we will access. If you may remember, during the first step of systematic search, we tried to know the PICOT question, we tried to know the search, and we tried to know the search term or the keywords or the key concept. Now that we will encode that, we will input that, we will type that in a search box. We have to know what kind of a search box are we looking for. We have to know the difference between what is a database and a journal. Is there really a difference between a database and a journal? Which one is bigger? Which one is more comprehensive? Okay, we have to know at least if the database that we are searching for is it free or does it entail subscription? And of course, finally, if you are having hard time and you are a novice, you are a neophyte, it would definitely be difficult to do that. So what we have to do is we have to ask the help of the librarian. Now, we know that the database are the gateway to that information. And the problem is we don't have the know-how, the technical know-how, how to access the database. Well, in that case, we have to admit and don't pretend. We have to ask the librarian because the librarian are those experts in doing the search. And that's why if you are doing a lot of EBP, then you have to be friend with your librarian. Treat him to lunch if necessary in order for you to get the information. Now, let's clarify once and for all. What is this databases? Let's take a look and listen.
As part of your research, your instructor may sometimes require you to use articles or other resources from the library's research databases. But what is a research database and why are they useful? A research database is an organized, searchable collection of information that allows you to quickly search many resources simultaneously. Databases can be general, such as Academic Search Complete or ProQuest, or subject-specific, such as PsycInfo, which has resources related to psychology, or America History and Life, which has resources related to history. Research databases typically include scholarly journal articles, popular magazine articles, and newspaper books and videos. The content of a research database is also reviewed and updated regularly.
Okay, so that is what is database is all about. It says this is a very, very broad index of information. And she even said that databases are like you are compiling all the books, you are compiling all the peer-reviewed research, you are compiling some clinical narratives, and the journals are in there. So it's indeed very broad. In our next discussion, let's see and try to know what exactly the difference between the journal and the database and an article. So this is quite confusing. Which is which? Database, journal, or an article? We will proceed to the next slide. Okay, at this point, we are still trying to clarify the differences between a database, a journal, and an article. And this is my analogy. This is the way how I look at it. A database, as you may look at it, there are three circles here. There are three spheres. The database is the biggest, the widest, and the most comprehensive of all this circle and sphere. That means it encompasses the journal and the article. That means a database is the bigger umbrella. And the middle sphere or the middle circle would be the journal. This is being embedded or annexed inside the database. And the very basic, the fundamentals of all this would be the article. And that article is contained within the journal, and the journal is contained within the database. And that's how we differentiate all of this. So we can barely say that the database contains the broadest, the widest, and the most comprehensive research evidence that we want to look for. Okay, so one reminder here is that when we choose a database, we have to consider the discipline of learning that we are involved, or the profession that you are looking for. In our case, nurses, we are involved in the medical profession, paramedical profession, and the nursing profession is very specific to that. And these are the databases that are specific to and are common among the nurses. We have here the CINAL, or what they call the Cumulative Index for Nursing and Allied Health Literature. As you may look at it, this is specific to nursing. And most of the researches of nurses can be found here in the CINAL. Okay, another one is the PsycInfo. This is more on the medical aspect. And then we have here the Scopus, that's behind my camera. And then we have here the PubMed. PubMed is one of the famous American journal, American database. And this is published by the National Library of Medicine in that country. And then there's a difference between Medline and PubMed. Medline is a project that oversees the National Library Medicine component, and the PubMed is that searchable database. This is in the field of biomedical and life sciences. So this is for free, the most accessed, commonly accessed, and the last is the Cochrane Library. Cochrane Library is a small type of database where it seems to be important in systematic reviews. This is a database that serves to be a gold standard if we want to look for systematic reviews. Take note that systematic review seems to be the highest in the hierarchy of or in the level of evidence, and that is where Cochrane Library plays an important part. Now, the next question is, okay, granting that these are the types of databases suited for nurses, then the next question is, what are those that is contained in these databases? The answer is that these databases contains the journal's publication, the conference proceeding, may also contains a research that is peer-reviewed, and the books. Okay, so what about if we talk about the journal? Now we know very well what is a database. Now let's proceed to the next slide and let's talk about what exactly is a journal. Now at this point, let's look into a journal. Oh, this is how it looks like. So colorful. A journal is a scholarly publication, and there are a lot of articles written here by researchers, professors, and other experts. And a journal, if you will compare this to a newspaper and a magazine, it's entirely different. There's a big difference. Why? Because this is intended for academic or technical audience, not for the general public, not for the general readers, because they may get bored or they may not be able to comprehend because the words and the terms are jargons and so technical for them to understand. And this is a specific discipline or field of study. Now, journals are usually made by a professional organization. Let us say you are a nurse and there are Saudi Nursing Council or Philippine Nursing Council or Indian Nursing Council. They used to come up with their own journal. Some are from universities, some are from hospitals, some are from different institutions, and there's a lot of journals. And these journals, they do subscribe to databases, as what we have discussed earlier. Now, the next question is, what is inside these journals? What can you find inside these journals? There you have it. The journals may contain some research that is being peer-reviewed. Some may not be peer-reviewed. It may contain some article synopsis, some editorials. It may also contain some news items and discussion articles. This may also contain some narrative reviews and systematic reviews. There's a lot of authors who wants their name to be there in that journals, and they want to have a publication. They want to be a published researcher or a published professor researcher, and they do subscribe to journals. Now, are you not curious about, what about Google? How is Google different from a database? After all, we're so used to searching everything and anything under the sun with the use of Google. Now, a database and a Google. Let's try to compare them. Why can you not use a Google and why do you have to look for database? Now, here's their differences. At the database, at the left side, publications are usually professionally done. However, in Google, it's more on a personal informations. And in database, there is an identifiable authority. Well, in fact, you can see their emails, you can contact them. Whereas in Google, sometimes the authority or the author is anonymous. There's no particular writer. And in the database, there are some search parameters that we have to use, and that's what we will be talking on the next slide. Whereas in Google, you will find it difficult to focus on the search. Sometimes there's so very broad topics that is out of context. And in database, you can easily access to the quality of the information. And in Google, sometimes it may take a long time, and yet the quality is not that refined. So that's it, database versus the Google. They're like fighting.